Hello, my name's Clare Hayes-Bradley and I'm going to take you through acquiring and maintaining team airway skills at Sydney HEMS. And for us it all starts with induction, doctors and paramedics coming together to learn to work together in a common system.
We're trying to take people who are really quite experienced and capable in their own fields and turning them into good pre-hospital and retrieval medicine clinicians. We've got a system of the virtual learning environment, the online learning, going through to workshops, looking at particular aspects to the RSI skill, maybe how exactly we would prepare our equipment, the checklist we would use, the language that we would use to communicate with each other. And lastly, sort of running that in simulations of increasing depth and complexity, so people really get a feel that they have the confidence to take that RSI out into the pre-hospital space.
Every 3 months the computer reminds me that my RSI or advanced airway practicals are due. Training kit and equipment is available in a small sim room, but can be taken outside or used in the hangar. Currencies usually take place during a clinical shift, overseen by the duty retrieval consultant for that day. Other staff members can get involved too, as numbers allow.
That's all right, I'll have a quick look at him. No vomit or spit in the mouth when I have a look in?
No.
Okay, and trachea, I know it's covered, but trachea midline, any subcutaneous emphysema or just
Difficult to feel, but when you took your finger off it earlier, there was a few little bubbles coming from.
While clearly of low fidelity, the sims are a chance for people to have a refresher and get hands-on with our kit and equipment, go through our protocols and how we work best together to troubleshoot any problems.
To think about what would you do, what would you change, what would you worry about?
The nasal prongs, or you want to?
Yeah, we'll go with the nasal prongs to get the blood going first.
A strong focus of the sim is always the RSI checklist, but exactly how the rest of the sim happens or the airway currency is done is left up to the duty consultant on the day.
I did at the end of the checklist. I always say it. I said there's no paediatric considerations.
Oh, okay.
Personally, I think that box should be up above checklist.
RSI currencies go. We've actually got a bit of a cheat sheet.
There's a two-sided aid memoir to RSI currencies that anyone can refer to.
Using CMAC videos can really help bring currencies to life. If you're doing an RSI currency of a pre-hospital trauma patient, it can help just to have a visual reminder of how bloody these airways can be, and we can all talk around how we manage that problem. Equally, the huge gastric regurgitation that we get, particularly in those cardiac arrest cases. Again, we can talk about the surprises that after maybe you're clearing your way past the tongue with suction, and you come across something a little bit unexpected, like a food bolus there. And a common topic of conversation is the paediatric airway, and often coupled with the conversation of near drowning. A lot of people haven't seen this florid pulmonary edema that you get with near drowning. And equally it's worth remembering in a near drowning case that you may well see regurgitation up the esophagus, as happens in this case here. And with paediatric laryngoscopy, it's so easy to be in too far with your blade tip, and the need just to pull that blade tip back in case you've gone past the laryngeal inlet, as happens here, and we start to see where that froth is coming from. Equally, we talk about problems with the video laryngoscope, and here's one where it's gone into like a Marvel comic mode. I think it looks great artistically, but it doesn't really help when you're trying to intubate. The middle one from an inter-hospital case here, just showing that they can be really dry and thick secretions there, and fogging of the camera is another common problem to discuss. And lastly, what about problems after intubation? So you show them a video of, you hear a cuff leak, you look down with your laryngoscope, and this is what you see.
On occasion we've done some patient-specific focused RSI currencies. This mannequin was made up to have a tracheostoma and be a laryngectomy patient. And our medical director, Carl Harbig, likes recreating the soiled airway for people to practice laryngoscopy with continuous suction on. We're lucky enough to have access to cyclic training. where every 13 weeks on a rolling programme, several doctors and paramedics get to work together in more challenging situations, not only practicing the RSI drill itself, but all of the decision making about when and where to RSI a patient, as well as adapting to the clinical environment. Our sim room also contains the kit and equipment for practicing our advanced airway techniques, also encouraged on a 3-monthly basis. There's another aid memoir of things people might like to cover and go through to practice. And we encourage currencies to happen at all of our 3 bases, even though at Orange, as you see here, the sim room may be not quite as fancy. Skills practiced one day on a mannequin in the Orange hangar, taken to the patient's bedside 2 weeks later, where on passing that A-scope through the end of the flexible ET tube, we see this most amazing epiglottis looking back at us. And what are all these currencies for? It's not so much a case of practice makes perfect. More practice builds confidence, and the team are happier that they're ready to go when the phone rings. And from induction through to maintenance with our airway currencies, it's a team endeavour.